The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Friday, December 18th, 2020. This episode is all about the latest discoveries that advance lupus research. Also, the most common blood disorders in lupus patients. So, you know what I want you to do? All the way from the United States to Central Luzon, Metro Manila, Philippines. That's right. Get ready to grab your cup of coffee, your cup of tea, and to my listeners late at night, you know I appreciate you. So get ready to grab your favorite glass of wine and come on and join the conversation right here on My Story Living with Lupus podcast. We all know the benefits of apple cider vinegar. Now, you guys know that I'm a vegan and that I have lupus along with other health issues. I used to take ACV every morning before I worked out, but eventually the taste of ACV got to me and I had to look for another alternative. And that's when a friend of mine turned me on to Goli. Goli is the first apple cider vinegar gummy. They give you all the benefits of ACV without the taste. That's right. Goli is vegan, gelatin-free, gluten-free, and 100% organic. And the vitamins and the ACV in Goli promotes a healthy heart by maintaining a healthy cholesterol range, controls blood sugar levels, and also curbs your appetite. And the best part about Goli, for every cell generated, a child in need receives a 6-month supply of essential vitamins with Vitamin Angels. So, if you don't believe what I'm saying, I'm going to give you some information so you can try Goli for yourself. Here's a promo code you can use. It's SUELYNN1. That's SUELYNNE1. And you'll receive 5% off of your initial purchase. Also, I'll leave a link in the description in the podcast. So, why don't you go and try it for yourself? You won't believe how good it tastes. That's Goalie. I thank you so much for joining me for another episode of my story, Living with Lupus. Today is Friday. That's right. Are you ready for the weekend? Do you have all your Christmas shopping done, or is every day Christmas to you? Now, you know, we who have systemic lupus erythematosus, we sometimes feel, or some of us may always feel, fatigued. How many of you really go to your hematologist on an annual basis to have your blood checked? Now, what we're getting ready to discuss are the most common blood disorders in lupus patients, which is anemia and low lymphocyte numbers are the most common blood disorders in lupus patients. Now, low levels of red blood cells, better known as anemia, and lymphocytes, a type of white blood cell, are the most frequent hematological disorders in patients with systemic lupus erythematosus, according to a new Turkish study. In most SLE patients, blood-related disorders, including cytopenia, which is a reduction in the number of blood cells, may be present at the time of diagnosis or develop over the course of the disease. These hematological disorders may be caused by the disease or be medication related. Now, scientists assess the incidence and causes of cytopenia and associated factors at diagnosis or during a follow-up of a cohort of 221 SLE patients, of whom 211 were women. The follow-up period ranged between 1998 and 2015. Cytopenia was observed in 184 patients, which is 83.3% at diagnosis. Anemia was detected at 124 patients, or 56.1% of patients. Leukopenia decreased white blood cells in 64, or 28.9%. Lymphopenia reduced lymphocytes in 168, or 76%. Neutropenia decreased neutrophils in 10 patients, or 4.5%, and thrombocytopenia, low levels of platelets in 38 patients, or 17.2%. I tell you now, all of this that I just stated is everything that is going on with my blood. Now, the proportion of patients with cumulative cytopenia, including development during the follow-up period was 90%, or 199 patients. Cumulative cytopenia was disease-related in 166 patients, or 83.4%, and medication-related in 33, or better, 16.6%. In disease-related cytopenia, combinations of corticosteroids with either Imuron or Cytoxan were the most used and effective. Imuron was also the most commonly prescribed medication in patients with drug-induced cytopenia. In patients with cytopenia, at the time of diagnosis, erythrocytes sedimentation rates, a test of inflammation, were higher, and C3 and C4 hypocomplementation, an indicator of immunodeficiency and susceptibility to infections associated with SLE, were more prevalent. Also, many of these patients tested positive for antibodies against dsDNA, a test to diagnose SLE. Now, with patients with cytopenia at the time of their SLE diagnosis, also showed greater photosensitivity, renal involvement, and antiphospholipid syndrome. Of note, the results also revealed no correlation between hematological alterations and other organ involvement, which is contrary to other studies in the literature. When we return, we'll delve a little more further into it, so stay right with me. Thank you for rejoining me. Now let's finish up with the most common blood disorders in lupus patients. Now, patients with cytopenia at the time of their SLE diagnosis also showed greater photosensitivity, renal involvement, antiphospholipid syndrome, better known as APS, a condition associated with an increased risk of blood clots. Of note, the results also revealed no correlation between hematological alterations and other organ involvement, which is contrary to other studies in literature. Now, in conclusion, the most common hematological disorders in SLE patients are lymphopenia and anemia, and patients must be further examined for antiphospholipid syndrome and renal involvement if they suffer cytopenia. Now, you know what is another disorder. Have you heard of inflammation-related anemia and lupus? Now, we know that red blood cells transport oxygen to cells throughout the body, but when people with lupus may experience a reduction in red blood cells known as inflammation-related anemia, which can cause a range of symptoms. Now, the signs of inflammation-related anemia or anemia of inflammation can show up throughout the entire body as the brain, organs, and other body tissues receive insufficient oxygen. The symptoms of anemia can range from uncomfortable to dangerous and even life-threatening. Now, anemia deprives the body of oxygen, which all of the cells in our body use in the process of turning carbohydrates and fat from fuel into the energy. When there are not enough healthy red blood cells carrying oxygen to your organs and tissues, your body is forced to work with less. This causes the following symptoms: fatigue and lack of energy, headaches and dizziness, difficulty thinking clearly, lower stamina during exercise, more muscle pain, and longer recovery time after exercise, shortness of breath, and pale skin. While treatment of inflammation-related anemia is possible, it is not always prioritized by lupus treatment teams. Clinicians often prioritize the health of organs, which is crucial, but can lead to people living with anemia symptoms. The symptoms of inflammation-related anemia in lupus can mask other symptoms of SLE and can get in the way of lupus treatment and a healthy lifestyle. Anemia can also be an important sign of dangerous SLE symptoms, such as internal bleeding or serious inflammation damage of the organs. Of particular note, anemia caused by kidney damage can inhibit the body's ability to filter the blood properly. This can leave toxic waste products to float around in the bloodstream. In general, people with lupus-related anemia were found to be more sensitive to light and to have more kidney problems. Organs besides the kidneys can also be involved and may provide clues for the optimal lupus treatment methods. Now, lupus and anemia. A study published in the European Journal of Rheumatology found that of the people they tested, over 50% of people with SLE experienced anemia as a symptom. Systemic lupus damages organs throughout the body, including organs responsible for blood production. These organs can include bone marrow, which produces red blood cells, spleen, which stores red blood cells, the liver, which filters toxins from the blood, kidneys, which 1, filter toxins from the blood, 2, produce erythropoietin, a hormone that encourages the production of red blood cells. The gut, which absorbs iron, a key component of red blood cells. Stay with me, and when we come back, we'll finish up. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. And we're back. What we're talking about is the most common lupus blood disorders. We're getting ready to go into macrophages and anemia. Now, in addition to impacting the organs, lupus alters the effectiveness of the immune system as a whole. One way it does this is by reducing the number of macrophages. Macrophages are white blood cells that eat and destroy bacteria and damage red blood cells. Fewer macrophages can lead to an increase in unhealthy and damaged red blood cells circulating in the body. On the other hand, during symptoms, flare-ups, the immune system of people with SLE can become turbocharged and end up attacking healthy red blood cells. If they attack too many red blood cells, then there is not enough for the body to use, leading to anemia. Now, lupus, anemia, and you. Fortunately, anemia, regardless of the cause, is very treatable on its own through medications. Okay. If the cause is unknown or isn't treatable, then synthetic EPO, the hormone that causes the bone marrow to produce more red blood cells, may help. And now, this is injected directly into the body. Medications that use synthetic EPO help spur the body into producing more red blood cells on its own. These medications reduce the anemia symptoms and may help with other lupus symptoms. These medications do have some potential side effects like with anything else. However, such as high blood pressure, swelling, fever, dizziness, nausea, and soreness. Synthetic EPO also does not address the underlying issues such as organ damage and might cover up the problems. As with all medications, talk to your lupus team about synthetic EPO to see if it is the right choice for you. Now, there are supplements. Now, if medication is inappropriate, or if the cause of the anemia is the poor absorption of nutrients into the body. Then injections of iron, vitamin B12, and folic acid may be helpful. These nutrients are key components to building and maintaining red blood cells in the body, and supplements of iron, vitamin B12, and folic acid increase blood production by ensuring that the body has enough raw materials. A diet rich in these vitamins and nutrients, along with dietary supplements, can also help. You need to talk to a nutritionist on your lupus treatment to help figure out meals and vitamin supplements that may be beneficial. Now, if that doesn't work, there's blood transfusion. For very severe cases of anemia, the best way to take care of it may be not so much producing more of your own blood, but getting an infusion of someone else's blood. That's right, an infusion. A blood transfusion will give you all of the blood components that you need and will help you build up a healthy level of blood. Now, with everything, like I stated before, there are side effects. Side effects are generally minimal, but for many people with lupus, this is only a short-term solution to keep them out of the dangerous levels of anemia. Give them time to find and treat the underlying cause of their anemia, or until they figure out the right treatment for their anemia. Now, some people with lupus, however, may find that blood transfusions are their only or primary choice. If you want to know more about lupus and inflammation-related anemia, there's a ton of resources out there for you. All you have to do is to research it yourself, or most importantly, talk to your rheumatologist. Have an open conversation with your rheumatologist and ask them for their advice. Now, methotrexate, an immune system suppressant and cancer chemotherapy drug used to treat leukemia and some types of arthritis, may lead to or exacerbate organ damage and anemia. So it is best that you contact and sit down and have an open conversation with your rheumatologist and your whole total healthcare team on what treatment is best for you. Now, what about the 4 discoveries that advance lupus research? You know, lupus is often talked about as an illness of mystery, but our knowledge of it has grown tremendously in recent years. The laboratory research done at HSS and other institutions is helping to explain the basic biology of lupus, while clinical trials and other forms of clinical research continue to enhance. Number 1, progress toward a second approved drug for lupus. Now, in December, an international team of clinical researchers published the results of a phase 3 clinical trial demonstrating the efficacy of the drug anifrolumab in lupus patients. If approved, it would be only the second drug approved for lupus by the U.S. Food and Drug Administration after Benlysta. Number 2, confirmation that women with lupus can have safe pregnancies. HSS rheumatologists published work demonstrating dramatic improvements in pregnancy outcomes among women with lupus. They reviewed patient data from 1998 to 2015 to look for trends and complications and reported a significantly lower rate of maternal death as well as lower rate of complication such as preeclampsia. Number 3, epigenetic approach to lupus treatment. Researchers at HHS published work suggesting the importance of environmental factors in the function of cells involved in lupus. Such research could sow the seeds for a new class of epigenetic drugs able to reprogram the cells involved in lupus to help them become normal functioning cells. And number 4, taking aim at the cells that produce interferons. HSS scientists and colleagues showed that significantly better treatment outcomes are possible in mouse models of lupus and scleroderma. When you stay with me, when you come back, I will be closing out because I have to get ready to go to my next appointment to see the gastroenterologist. So stay with me. All right, everybody. I really appreciate you joining me for this episode of my story, Living with Lupus podcast. Also, I want to especially thank all my new listeners and all the new stations that my story Living with Lupus is on. And I want to leave you with this. By the time you're listening to this, depending on the time of the morning that it is in your country, morning, noon, or night, I'll probably be sitting up in the gastroenterologist's office. I have seen the oh my gosh, I would have seen my oncologist. You see, that brain fog is kicking in. My oncologist, and I plan to tell you about that next week on the 24th will be the last podcast for the year 2020 of my story Living with Lupus. You know I'm going to see you in the new year 2021. But I will tell you all about my visit with the oncologist and the gastroenterologist. That fog is kicking in. But I want you to sincerely, deep down within your heart, know giving thanks not only help us recognize our blessings, but it also unlocks the doors of heaven and help us feel God's love. Giving thanks for each new morning with its light, for rest and shelter of the night, for health and food, for heal and food, for love and friends, and for everything thy goodness sends. Give thanks. I'm Susan Hendricks, your host for My Story Living with Lupus podcast. Have a most peaceful, safe, and oh so blessed weekend. Please join me for my last show of 2020 on December the 24th. That will be my last show for this year. And you know, I'll see you in 2021. So I'll see you guys next week for another episode of My Story Living with Lupus podcast. The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved.